So let's hear from MEROVA, and psychologist and educator is joining us now, Rika Rozsos. My Hungarian is probably not anywhere near as good as it should be. I can just about say a few words, but Rozsos. Okay, we'll get it right. Good luck. Lovely. We're going to look forward to hearing from you, Rika.
Okay, so in the past couple of years, humankind had to readjust and relearn so much. Please put your hand up if you had to teach your child how to study from the living room, or smile or wink at your neighbor if you also had to bring your office to your living room, or put your hand up if you had to schedule a family event online. We also had to learn how to take care of our own health from our home without hospitals or without the healthcare professionals that we are so used to having. So platforms that can accommodate these needs are growing and ever so popular. But our story does not start here. It starts in 2018, where I was sitting in a coffee with my father, who told me that he's been working for the past 30 years with patients affected by diabetes with a group of doctors, and they have developed a very successful method with thousands of successful treatment stories. And he's ready to start writing another book about his newest findings, but he doesn't want to write a book anymore because books just cannot follow how fast the medical field is evolving. So the idea of an application that can be updated was born. It was not born because of the pressing need COVID showed us, although our platform did come in handy. It was born because there are some staggering numbers. For example, 422 million. This is the amount of people who live with diabetes worldwide. This is the number 9 leading cause for death worldwide, but we don't know much about it commonly because this is a slow and silent disease. But among the outcomes that diabetes can cause, there is heart failure, kidney problems, blindness, or our main focus, which is the loss of a lower limb. So based on this 20 plus, nearly 30 years of experience, we have developed an application for doctors and for patients that can store all this knowledge and that can help these participants to build partnership. This platform can help the patient to understand what they are going through. It can help the doctor to communicate with the patient. And it is honestly a lot more than just searching for your symptoms online, because it is personalized for you. There are hundreds of different treatment plans that you will find that you can read that is reliable, developed, and written by doctors. Well, doctors will care about your physical health, but I'm a psychologist, so I have to care about mental health. And I guess we can all agree that if there is a lot of worry, anxiety before you receive your diagnosis, or after you receive it, there is a lot of anxiety when you have to face the uncertainty of the future. This can cause and this can take a toll on your mental well-being, not just yours, but everybody else around you. But I have good news. In the 21st century, we operate with a new term, the expert patient. The expert patient is a person who takes a little bit of the responsibility back from the doctor, who is also part of the treatment process, who also needs to understand what is going on with them. For this, we need to educate them. We need to give them the tools so that they can take a little bit of control back. They can work in partnership with their doctors. Think about it this way. If you get lost on the road, and you cannot find your way, you take your phone and you consult a navigational system. Our platform, our application, is a navigational system for the path to a healthier future, because it is in your pocket. You can consult it even if you cannot see your doctor at that time, let it be pandemic reasons or other life situation. You can consult it and store all your important information that you ever need. Or it can also broaden your horizon when it comes to thinking about your diet, the movement, or the application will actually tell you what kind of socks you should wear. So it is very important not to get lost on this road when you're trying to take the control back, because research shows now that if the patient holds the knowledge, it is an unused resource that has huge potential. So what we are trying to do is give this knowledge, give this tool to the doctors and the patients so they can work together in partnership, not without each other. Patient can take a little bit of the control back and understand what is going on with them. This application right now is a Hungarian application for Hungarian users because we are from Hungary. We have 5,500 active users, 8,000 downloads, but we do believe that there are millions worldwide who could use the information like this. So this is our goal, to develop an English global app that can be altered for the different countries, working with local professionals in each country. So what we would want to do is to make this platform friendly, nicer, maybe even enjoyable. It would be difficult to tell you how this looks like, so let me show you some images. All right, so in case you're interested, or if you hear this call for action, or if you believe that maybe you can use some more information about this, find us in the Hungarian pavilion tomorrow at around 2 o'clock, and, let's talk about the future. Thank you so much.
Thank you so much. Once again, köszönöm.